I'm Ted Werbin, News Radio 84 WHAS, with news on demand at WHAS.com and Facebook. Depend on it.
Tony Cruz and Cindy Sullivan, obviously the death of Robin Williams called attention to depression for a lot of people, but also apparently to Parkinson's disease, which some are speculating that Mr. Williams really had a hard time overcoming that. There are others, though, including his friend Rob Schneider, who blames the drugs he was taking for the symptoms of Parkinson's on side effects of being a suicide. So Al Johnson is here, Dr. Al Johnson back with us. Dr. Al, have you heard about this, and is that accurate? Are there certain drugs that create this issue for those who have Parkinson's?
Yes. Well, about 50% of Parkinson's patients have depression along with it. As you well know, Parkinson's is a process that affects the brain, that affects the dopamine production. It also can affect norepinephrine production, which is part of the depression-type problem. The drugs used to treat Parkinson's have side effects along with the symptoms of the disease. So, yes, drugs can compound the problem. The big challenge in treating Parkinson's is to balance up the drugs because there's no cure for it. It's just managing the disease.
It is an interesting and devastating disease. My mother-in-law, Dr. Johnson, suffered from Parkinson's disease, and she was on medication that actually helped her manage the symptoms and did very well with it. So there are some cases when everything does sort of work out. Oh,
exactly. There's some that do very, very well. There's some that have a real progressive disease process. There's other ones that have a much less aggressive form of it, and they respond very, very well to medicines and do well for a number of years.
Robin Williams' wife wrote that his sobriety was actually intact. She says, quote, and he was brave as he struggled with his own battles of depression, anxiety, as well as early stages of Parkinson's disease, which he was not yet ready to share publicly. You couple that, there are some who say that he was bipolar, manic depressive, and it can become a lethal situation. So there's two questions, a two-part question. One is, for those of us who have loved ones who suffer deep, dark depression, it's hard for some people to understand. How can you try and help them get treatment? Because they have to come to their own conclusion to do so. And the other is, what about Parkinson's? When you have that discovery, how can you learn to adapt and learn acceptance with these kinds of disorders or problems?
The first part of it, those family or for friends that have depression, it's important that the individual that's concerned sit down with them, talk with them, help them understand what is going on, because a lot of times they do not, and then really work with getting them some help. And many times that means going to the doctor with them, explaining what's going on, help them, encourage treatment. And if you aren't getting answers with the first doctor, seek a second or third opinion even. I treat a lot of people that have seen 8 and 10 different doctors because they aren't getting answers. And it's a matter of the doctor sitting and listening to the patient, figuring out what's going on, and then working with an appropriate treatment. The second question was what now?
Well, just about Parkinson's, when the diagnosis is made, I mean, it would, just like cancers or other things, I mean, I can see where people would just fall into a depression anyway.
Exactly. People are concerned about themselves. They know something is going on, but they don't know what. Diagnosis is made, and some people it's a relief. Other people, they get very depressed about it. And in Mr. Williams' case, very brilliant, spontaneous individual, and Parkinson's was hindering that whole process because it affects the muscles. It can affect somewhat the speech. It definitely affects the facial expressions, which we're so used to seeing in him. And along with the other problems, it could just be overwhelming.
Well, one of the things that we talk about a lot with on a regular basis is just making sure that you're communicating, and maybe one of the silver linings of this terrible situation is the fact that it is bringing to light these topics like depression and dealing with diseases and conditions that and trying to get this, be a little bit more open about it.
Mm-hmm.
Yeah, exactly. And if something's not working, then you kind of got to think outside the box even. And there's a Dr. Perlmutter who wrote a book about Parkinson's, and I use his treatment method all the time, which involves hyperbaric oxygen treatment along with nutrients that help, that are precursors to the brain hormones. And then there is a urine test by neuroscience that can actually measure some of the brain hormones, and you can use that as a guide because the antidepressants won't work if you aren't producing enough serotonin.
Right.
So sometimes you have to use a little 5-HTP, 5-hydroxytryptophan, that helps your body to produce serotonin so the antidepressants work. And this is thinking outside the box of standard medicine, but sometimes that's necessary to really help a person.
Dr. Johnson, always a pleasure to talk to you. Thanks for joining us. We appreciate it. Thank you.